Hello. Today we are talking about estrogen, which is a key player in vaginal health. Did you know that vaginal dryness isn't just something that's uncomfortable and we just need to deal with it? It can affect our intimacy, our confidence, and our overall quality of life because it causes infections if we don't deal with it for many women. So stay with me because most women don't really realize what's causing it or how to fix it naturally. So you're watching straight from the doctor's desk with me, Dr. Andre Purcell, specialized in natural medicine for women. I've been doing it for over 20 years, especially during those hormonally intense years of midlife. And I'll just say that for way too long, women have been told that's just menopause. We just have to deal with it. But vaginal dryness is your body sending you a signal. And if you ignore it, then the knock on the door is going to get louder and louder and louder. Okay. So the good news here is there are gentle ways to restore your comfort, help you feel at home again in your body, not have pain during intercourse, not deal with annoying itching or infections or just pain. So what women often just don't realize is that vaginal dryness isn't a lack of lubrication. It's more of a change of the actual tissue and the microbiome within that tissue. So as estrogen declines, vaginal tissue becomes thinner, less elastic, more fragile, if you will. Blood flow decreases to the tissue, which can make sensation and arousal more difficult to get to. So that's why so many women notice dryness, but also a drop in libido or pain or discomfort during intimacy. So it's not you. There's not something wrong with you. Your body didn't break. It's just about understanding what your body needs during this new chapter, how to support it and how to help it. It's nothing to be ashamed of. So when estrogen levels decline in midlife, this affects many things in the body. It can show up in the most obvious of hot flashes. The main issues can be vaginal dryness for women, and it just depends what symptom you're going to get. So dryness is only part of the story. So low estrogen changes the structure and function of the tissues, which can increase discomfort and raise the risk of infections. And it's vaginal infections and urinary infections. So if you're dealing with chronic urinary tract infections, that has to do with the drop in estrogen and how that is affecting the tissues. So normal tissue is plump and bouncy and lubricated. And when the estrogen drops, the tissue becomes thin and dry and there's like a drag. So estrogen increases circulation to the tissues, which helps maintain the moisture. So it can thicken and strengthen the vaginal tissue and the urinary tissue. It supports collagen and elasticity, and those tissues stay nice and plump and bouncy rather than thin and fragile. Estrogen also encourages the glands in the vaginal wall to produce that moisture, which then cuts down on the dryness as well. So estrogen plays a huge role in the vagina's microbiome, which means it helps maintain a healthy pH balance of the vagina and the urinary tissue. So estrogen encourages the growth of lactobacillus. I know you've heard of this. It's in all the probiotics out there. So lactobacillus acidophilus, the good bacteria that keeps the vaginal pH slightly acidic. And this acidity protects against yeast overgrowth and bacterial infections. So women can get more yeast infections when the estrogen drops. They can get more bacterial vaginosis when the estrogen drops. So a balanced vaginal microbiome prevents the overgrowth of harmful bacteria or yeast, and it strengthens the tissue's resilience. Healthy vaginal tissue that has estrogen is less likely to develop micro tears that also allow infections to take hold. So estrogen is more than a reproductive hormone. It's actually a protector of vaginal comfort and health. And we can support estrogen naturally. There are certainly different types of herbs and botanicals, things like phytoestrogen-rich foods, or in some cases, bioidentical hormone replacement or just estrogen suppositories. Many medical doctors prescribe estrogen cream or estradiol cream that can help reduce dryness, restore elasticity, and lower the risk of recurrent infections. In natural medicine, there's many different choices that are safe, and vaginal estrogen is not absorbed very much systemically, meaning throughout the whole body. It stays localized to the tissues. So you don't have to suffer alone. This isn't something to be embarrassed about. You can restore your comfort. You can get out of pain. You can get your intimacy back. I don't want you to just get through menopause. Like, okay, I just need to get through menopause. Let's do this, right? I want you to thrive. I want your relationships to be better than ever. And I want you to feel strong and empowered. So there are natural, effective ways to restore the balance and heal the vaginal and urinary tissue. And I want to give you 2 ways that you can get a head start on your health today. One, you book a free discovery call with me. We could talk one-on-one about your issues, see if natural medicine is a good fit for you. If that's a little too overwhelming, you can join my email community. If you want to start with a small step, you can sign up for my weekly newsletter and my blog and get tips and tricks all about natural medicine, how to manage menopause from a natural perspective, and improve your health overall, because your body deserves care, comfort, and confidence at every age. I'm rooting for you.